Hello, everyone. I'm glad you guys could join us. I'm Ashley Watts, President and CEO here at the Kentucky Chamber of Commerce, and I'm really excited about this webinar today. I first want to thank our sponsor in this endeavor, our Community and Technical College System, KCTCS, who has been a big part of our Restart Kentucky initiative and really a big help with our webinars. And we're happy to have such a good number with us today on this. The last couple of weeks, as we know, there's been a lot of movement with the reopening of business. And this week, we are really excited. I think there's a lot of optimism in the air when we talk to our members, because we are seeing the reopening of business. Yesterday was the first day for retail. Tomorrow is the first day for restaurants. I already have my reservation for a restaurant tomorrow night, so I'm really excited about that. But I think there's a lot of optimism as we've seen kind of the time frame move forward with businesses starting to reopen in a very safe and methodical manner. And so the last couple of months, these webinars have really been a good resource to answer the questions you all have as the business community. And recently, the questions that we've been getting here at the Chamber, and please keep them coming, have really centered around business reopening and the requirements, as well as unemployment insurance. And so we're fortunate enough today to have some guests with us that are the experts in these, and we'll kind of go through the questions. I would like to first introduce Jonathan Smith. He is the Deputy Chief of Staff with Governor Beshear, and Jonathan probably hears from me more than he wants to these days, but I would just commend him and his staff. They have been very excellent and communicative with us. We have worked very closely on the requirements and what recommendations we had, and so I just want to thank them for their effort to really make sure that business gets reopened in a really safe way, to make sure that we're protecting all employees and all patrons as we start to reopen. And so he's going to kind of start off by talking about requirements and reopening, and then we're going to turn it over to Josh Benton, who has done a webinar with us before. And Josh is a good friend of the Chamber. He is the Deputy Secretary of the Education and Workforce Cabinet. And you guys have probably seen him on a couple of the 5 p.m. press conferences as he is handling all unemployment insurance. And as you guys can imagine, that is not the easiest job. But I would like to thank Josh and his staff that have been very communicative with us. They've been able to fix a lot of the issues that some of our members have had, and we're very appreciative of you guys being so communicative and working with us. And then today, we're gonna have our VP of Public Affairs, Kate Shanks. She's no stranger to any of you all. She's moderated a couple of these webinars, but Kate's gonna kind of do a Q&A to make it a little bit more informal and more like an interview type of style as we go through. You did have the ability to ask questions beforehand, and so Kate and I have worked through those. We have given them to Josh and Jonathan, and so we're going to use those questions as we go through the conversation. We do have the chat button open if you have any extras, and we'll try to keep track of those as we move forward. Just a reminder, for if you want a refresher on this or want to send this webinar to anyone, we do record these and we put them on our website probably this afternoon. One quick thing before I turn it over to Kate. You guys know we try to do about 2 webinars a week. This is a little bit of an unusual week where we're doing both of them in one day. So at 3 o'clock today, I would really encourage you guys to sign up for the webinar with Governor Beshear and Mark Carter, who is the new staffer at CHFS that is going to be handling all the contact tracing. So we're really fortunate that the governor is going to be able to join us for a webinar. And Mark Carter is no stranger to the Chamber. In his previous role at Passport as their CEO, he has served on the Chamber board. So we're really looking forward to that webinar at 3. We've gotten a lot of questions about contact tracing in the last couple of days. So it'll be a good time for us all to get educated on what we need to do to move forward. So with that, thank you all for joining us. And I will turn it over to Kate.
Great. Thank you, Ashley. And thank you to everybody for being with us this afternoon, and to our experts that have joined us that are going to help us answer some of the many questions that we've been getting from our members. We really appreciate you all taking the time. We know that you're super busy. Can't imagine how much you're juggling right now, but we really appreciate you being a part of this discussion. So we have a lot to talk about. Let's go ahead and jump right in. And as Ashley mentioned, we're going to start with Jonathan. Again, welcome. Why don't we start talking a little bit about the reopening schedule? We have a kind of a new wave of reopenings that we're seeing right now. The restaurants, retail. I think we've heard some new announcements on tourism. Can you give us, Jonathan, the latest on some of that?
Sure. Thank you, Kate. And first off, let me say thank you for having me. Thank you to Ashley. Want to thank the Chamber. We've partnered closely on this. We've communicated very well over the course of the last several weeks. We've partnered on PPE and testing and making sure folks have the resources they need to be healthy at work. So I really appreciate what you guys are doing and what you have done. So our team has been working really hard on a gradual, phased in, safe return to work. We've been obviously following the CDC guidelines on reopening very closely. Our Healthy at Work team consists of Latasha Buckner, our Chief of Staff, Secretary Larry Hayes, Secretary Larry Roberts, and Secretary Jim Gray, along with their staffs. And we've been working closely, obviously, with Dr. Stack over at the Department for Public Health and his team. So we have a lot of good information up on our website and our most up-to-date timeline at healthyatwork.ky.gov. And for the folks participating in this call, we've received about 1,400, over 1,400 plans and submissions from different industries, different groups, different trade associations. So for all of you that submitted something or helped out in any way, we appreciate it. It's definitely gotten us the information we need to make smart decisions. I think you guys mentioned it. This is a big week for us. Retail came back online yesterday, and we've got restaurants opening back up tomorrow, along with groups of 10 people or fewer. And I know a lot of folks are looking forward to the weekend. So the rest of our timeline and our guidance is up at healthyatwork.ky.gov. I'll just look at a little bit here since you guys can access it on your own. So we started with May 11th, constructions, horse racing with no fans, manufacturing and distribution, office-based businesses, pet grooming, photography, and car dealerships. A lot of these businesses are businesses that are low touch or no touch that allowed us to bring them back online on May 11th. And I got to say, everybody that we've been working with so far along the way has been great, has been helpful and responsive, and everybody's trying to do the right thing right now. And we really appreciate all of that. May 18th, we've got our guidance for government offices and agencies. And so looking forward, today's the 21st. On Monday of next week, we're looking at barbershops, massage therapy, nail salons, tanning salons, and tattoo parlors. Those are obviously more higher touch scenarios. So we thought we needed a little more time there. And then in June, I think we're going to start to see a lot of things, a lot of the entertainment that folks miss and badly want to get back to, like fishing tournaments, fitness centers, movie theaters, state park lodges, bowling alleys, aquatic centers, all of that. Right now we've got childcare coming back online for June 15th and youth sports as well. Obviously, I know this is a really important issue to all of our families, but it's one that we wanted to be careful with because kids are, it's hard to reduce contacts amongst kids. And then in July, we're looking at groups of 50 people or fewer. So that's kind of where we are on the timeline. We've got some minimum guidance for businesses, which include stuff that you guys have heard a lot about and that you guys have been working on, the masking of employees, social distancing, taking sanitation measures, and all of that. And then we've got some individual guidance specific to different industries, whether it's manufacturing or restaurants. And again, all that information, you guys know this, can be found on the website. So I don't need to go in too much detail there. But I think that's kind of where we are. We're excited about some of the things coming back online this week. And I think we've got a lot to look forward to in the weeks ahead.
Good, great. Thank you so much. And, you know, we are certainly looking forward to seeing a lot of these facilities reopen. I know we're all eager to get out of our homes and enjoy, you know, the summer that's coming and get, of course, our children out as well. So you mentioned the website. I've encouraged so many businesses to bookmark that website. It's constantly updated. If your particular facility has not been reopened and you don't see requirements listed, it's coming. So you'll see links where there are requirements posted, and you'll eventually get to see those requirements for your facility if they're not yet posted. I do want to point that out. You mentioned the general guidance or excuse me, requirements that are out there. That's a really great document to go ahead and look at.
Yeah.
Anything specific you want to say about certain sectors? You know, for example, restaurants, there was a lot of discussion about capacity reduction. I've seen some great pictures on social media where they're starting to show their customers, this is what we've done to our facility to keep you safe. Any specific sectors that you think are worthy of noting some specifics?
Yeah, I mean, I think that what we're trying to do is keep it as consistent as possible. So for a lot of the retail settings, I think the number that we've settled on is 33% to start out. So hopefully you'll see that that be applied consistently across those different industries. I know folks are looking forward to going back out to eat and doing things that they normally do. We just encourage the individuals to be careful, and the employers as well. It's probably a little safer to sit outside on a patio. And so with the nice weather that we can have here in the next few weeks, that may be a good option. But no, I mean, I think we're trying to make sure that we're applying the standards the same to everyone. And I don't think I could single anything out.
Okay. And just to clarify, because we've gotten this question, had you been a critical or essential business prior to, or when these initial closures were done, and maybe you didn't have to mask and you didn't have to meet these requirements are for all businesses that are laid out by sector. And so even if you weren't forced to close back in March, you're still expected to follow these requirements, correct?
Yeah, that's right. And that's just because we're expanding our contacts and more people are going to be coming back online. So we're going to have to take those extra steps and be safe as people begin to be healthy at work. So yes, it does apply to all businesses, including the ones that weren't shut down.
Right. That's good to know, good to understand. Let's talk for just a minute about childcare. I think we're expecting guidance this week, possibly. And this is a really important issue for the chamber, because if people are struggling with finding proper childcare, how do they go back to work? So what's the latest? Is there anything you can tell us about that in terms of occupancy? We know the date for when it would reopen, but just some general thoughts on that so far.
Yeah, and like I said earlier, I know how important of an issue this is for working parents to have these options, and we're working on it right now on the website. We've got June 15th listed as the target date to return, obviously with some restrictions. We should have guidance out this week. I'm confident about that, and that will give everybody the roadmap to opening back up the childcare piece. We want to be careful. Like I said, reducing the number of contacts among kids is obviously a major challenge in these settings. But you should see something pretty soon, and hopefully it's helpful to folks.
Good. And are you including summer camps and summer sports kind of in that schedule as well, since it's the children contact?
Yes. So we're including the summer camp guidance with the childcare guidance. Okay. The youth sports guidance will be different, but it's on the same day right now, June 15th. Okay. So yeah, those things will be coming back online around the same time.
Asking for all the parents out there as well, since we have kids that are really eager to get out and enjoy their summer camp programs that maybe are a little too old for daycare. So that's interesting that you're including it all together. And we'll just stick with kids for one more minute, because I know there's been a lot of activity on social media and a lot of advocacy about our pools. Plans on aquatic centers and swimming as a sport. Right. Still no schedule yet, though, for public pools, correct?
Not yet. I think the governor addressed this last night. I expect it'll probably come up every press conference or every other press conference, because I know a lot of folks are asking about it. But we're having those conversations. We're talking about it, and I'm sure he will address it again soon.
Okay. So let's switch gears for a little bit, Jonathan, and talk about an area that we're getting a lot of questions about, and that's the health screening aspect of the reopening. And this is something that really businesses haven't been doing before, and it's new. It's something we're learning how to do at the chamber, but there are requirements for health screening for your employees. Temperature, which can be done off-site, certain symptoms identified by the CDC if you had a cough. And it's really just a checklist. So what do employers need to know, or what are the steps if an employee checks one of those boxes that, yes, I have one of the symptoms of COVID-19? Do we then move into testing, and what are the requirements and I guess the rights of employers in managing their staff who may have symptoms?
Yeah, so I mean, I think the point of the screenings is to try to catch folks before they get to work, return to work, and potentially spread the virus if they are showing symptoms. And hopefully by doing these screenings, we can isolate them and get them and stop them from making contacts with their colleagues. I think at that point, then you would like to get that employee tested to see if in fact they are positive, and then have them quarantining or isolating at home after that. I can tell you in state government, we offered tests. We set up a drive-through testing location for our employees this week. And I think it's worked out really well. The drive-through testing sites, they get you through the queue in about 3 to 5 minutes these days. So it's pretty convenient for everyone. And it gives our folks the chance to get tested and feel like they're safe at work. We've not made that a requirement for state employees. It's strongly suggested. I got tested myself on Monday, as well as the rest of our staff here. So I think employers should obviously work with their employees about getting tested at different times. Maybe it's because they're showing symptoms. Maybe it's because they just want to get everybody tested at a certain point and take that and take a snapshot there. So I think that's what the purpose of the screenings is, to try to get people from spreading the virus if they have it. And we have a lot of testing opportunities. There's a story that came out this morning about our testing capacity being ahead of the White House guidelines. And so we're happy with that. We worked really hard on that. There are opportunities for Kentuckians all over the state, and we're working every day to increase our capacity.
And you mentioned the Healthy at Work website. We have our Restart Kentucky website that has a link to all the testing sites that the state has been maintaining, and they are throughout the state. And so, it's probably something employers need to make sure they have that information ahead of time, so that if somebody does have the symptoms, they can know exactly where in their community to send them to get testing and what steps that they need to take. Assuming someone does test positive in the workplace, and we'll talk more about this when we get into contact tracing in a later webinar, but there are certain steps that employers would need to take as well. And would that be handled mostly through the contact tracing effort that's underway that we'll be discussing, additional sanitizing, things of that nature that they need to think about if they do have an employee that tests positive?
Yeah, and so let me talk a little bit about the contact tracing piece. We're excited about that. We feel like that is one part of being healthy at work. So that is, Mark Carter is going to head that up, which I think Ashley announced. And our contact tracers are going to help folks who've tested positive communicate with the folks that they work with, or the folks that they've come in contact with in their daily lives about the fact that someone tested positive. And this is really a key piece of it. The quicker that we can respond, the quicker we can get a positive result and get that information down to the people who may have come in contact with them, the better, the more success we're going to have in removing them and from them spreading the virus. So we are building that up right now, and hope to have more on that soon.
I'm just scrolling through some of these questions specific to health screening.
Yeah.
If an employee gets tested, what about the employees that work around them? It's my understanding testing is open to anyone.
Yeah.
And employers could certainly encourage their employees, if they had been around someone who had symptoms, to go ahead and get tested, correct?
Yeah, and I'm checking our website right now. Right now on kycovid19.ky.gov, we've got 155 testing locations set up through the state. Some are drive-through, some are at hospitals, some are at clinics, some are at local health departments. So that's a pretty comprehensive list of where folks can get a test. Each testing site may be a little different in terms of whether you need to have symptoms or whether folks that are asymptomatic can get a test. I mean, I think if someone tests positive in the workplace and they've been in contact with some of their colleagues, that yeah, it's probably a good idea to get those other folks tested too.
And obviously if someone tests positive, before returning to work, they would need to get cleared by a healthcare
Yes.
professional that would clear them to return to work. And of course, if someone tests negative, maybe they have symptoms that's related, but not because of COVID-19, a negative test would be helpful in that regard.
Yeah, I'll leave that to the health experts, but I think that generally speaking, that's correct.
Great, this is helpful. A few more questions.
Yeah.
Assuming, employers are of course following the law, they've put these new requirements into place. What role will the local health departments have, or the state occupation safety and health administration have in sort of regulating this space?
Yeah.
So it's now a new, these are new requirements, employers have implemented it. Will there be inspections? Will it be something where somebody may, an employer or customer may call and say, I have concerns about this? How do you see that working?
Well, so I see our public health departments being essential in all of this. I mean, I think that they're going to be working with employers about how to keep them safe. They're going to be working with our contact tracers, who will be sort of centralized, but will be working with the public health departments that are spread out across the state. Our labor cabinet has some of those resources to receive calls from folks who have concerns, and I know that they've gotten some along the way. But I mean, I think for the most part, we expect folks are doing the right thing, are taking everything seriously, and are going to be ready to go.
Okay. And we do as well. I mean, we've had so many conversations with businesses and seen pictures. We've done some webinars with some of them, and they've shown what all they've done, the plexiglass, the taping off of areas. I mean, it's pretty expansive what businesses have done to prepare for these reopenings. So I think once we all get out and see some of this, we're going to be really amazed by the steps that they've taken for sure. Let's talk a little bit more long term. I know you don't have a crystal ball and you can't really predict, but what are some of the things that you all are looking at that will help you ease additional restrictions? Like, what do you need to see in the next month? Are we just looking at a reduction in the growth rate of cases, or do we need to get people out testing more? What are some of the metrics that you all be using to say, okay, it's time to move on to phase 3 or late phase 2?
Yeah, so we're looking at all of it is the short answer. We're looking at our testing capacity and making sure that it's increasing and is where it needs to be. This contact tracing piece is an important part of it too, so we can communicate quickly with people on the ground that they may have been exposed to someone who tested positive. We're obviously excited about some of the things coming back online and seeing how that works out. We're going to be keeping an eye on the rate of positives. Obviously, as our testing capacity increases, that may increase our positives, but it's about that percentage based on where we've come and how we got here. So I think we're going to be taking it all into account. I don't think you can make decisions based on just one or two data points. You've got to kind of consider it as a whole. And that's what we've been doing, and that's what we're gonna continue to do as we have our conversations and look at the data and hear from you guys on the ground.
Are you watching other states as well? Are there specific things you're looking at?
Yeah, so Governor Beshear has had weekly calls with Governor DeWine and Governor Holcomb in Indiana and Ohio. They've developed a very good relationship, trading ideas together. About what's going on in their state and some of what their thoughts are. I know that I think Ohio opened restaurants at the same time, May 22nd. So we were right in line with them there. And so yes, we are. I would say we're definitely looking at things geographically and what our border states are and where our cities are in relation to some of these other states and how quickly they can get there. And I think Kentucky's, if you look at Kentucky compared to the rest of the country, we're probably right there in the middle. And I think Ohio and Indiana have been good to work with. And those are two of the states that we're looking at probably the closest.
Do you think it'll be important for businesses to have contingency plans? Should we see cases tick up, do you see a scenario where we could say, well, we've opened, now we need to pull back? Or do you think that's unlikely?
I think it's important for everybody to be flexible. I think it's important for state government to be flexible. I think there are still decisions that haven't been made yet, and things have changed quickly. So I think everybody has to be ready to make adjustments if necessary. And I guess until there's a vaccine that is available for widespread distribution, we're all going to have to, I guess, be a little flexible. But I think we're in the right place right now. I think the stuff that's coming back online, I think, is going to give folks something to look forward to. And it's going to be a test for us, but I think it's going to be a test that we pass.
And we're getting several questions, so I'm just going to repeat a couple of things.
Yeah.
The website, can you go ahead and tell everyone again? It's the healthyatwork.ky.gov.
Yeah, so we got some really good resources out there that I think is helpful for folks. Healthyatwork.ky.gov. That has our minimum requirements, our timeline for businesses coming back online, and then the individual guidance for each industry. You can find the latest information on the virus, the state's response, the number of tests, number of positives, and the number of and all of the testing locations that I mentioned earlier at kycovid19.ky.gov. That's a lot of the information that Governor Beshear gives the state at 5 o'clock comes from there. And I think those testing locations is really helpful, so you can see a map of where they are located geographically and where you can go get a test if you're in Western Kentucky, for example. And that's fluid. It's always changing. There's testing sites coming online, clinics offering it, hospitals offering it, and that kind of thing. So we've actually encouraged healthcare providers to send us their information. We'll get it on the website, and we'll have it up for everybody to see.
Great. And also, when you look at those requirements that are on the Healthy at Work website, the CDC symptoms that you check for, I've seen several questions about the symptoms themselves. They're listed in those documents. The fever, the cough, what fever level it needs to be. You can get all that information, and that's coming from the CDC, I believe. So a lot of really specific resources for employers, and you mentioned it does get updated quite a bit. So we do encourage you to bookmark that site, and also check out Kentucky Chamber Restart Kentucky site as well. We link to a lot of this as well. This has been really helpful. I do want to remind everybody that we are going to be doing a session on contact tracing. It is today. If you're watching this on a recording, you'll have to watch for that. So we'll probably get into more detail about what happens with an employee that's sick in the workplace and how contact tracing will work. So there's some more specifics on that topic that we'll be addressing in the second webinar for today. But I feel like we hit kind of the highlights and made sure we got out there the resources. And I think it'd be good for us to just switch gears for a minute and bring Josh Benton on. He is our unemployment insurance expert, and he's Deputy Secretary of the Cabinet that handles this particular program. A lot of discussion about unemployment insurance. We've gotten a lot of questions about that. So if you're on the line, watching, wanting to engage on this topic, please send us your questions on that particular issue. And then we'll keep Jonathan on as well at the end. Maybe we might have some additional questions for both of you all to answer. But Josh, welcome. Thanks again. It's great to have you on again. I know this is your second time with us on one of these webinars, but it's a very important topic that we need to address, getting lots of questions on it. So let's start, I think, with one of the big questions that we're getting quite often. So as businesses reopen, they're calling back their employees. What is the process that businesses need to take, or that employees need to take, to go from unemployment to being back at work?
Sure. Well, Kate, thanks for having me on again. And it's obviously a transition from what we talked about last time. Last time we were talking about all the changes that were taking place with unemployment insurance, all the eligibility requirements that had either been loosened or modified, and now talking about returning to work. So that's, we're glad to see some transition in that direction. I think what's important for everybody to realize, both employees and employers, that when it comes to returning to work, we at the beginning of this, we did not know when we'd be at this point. And so, many times, or I shouldn't say many times, but usually if it's a temporary layoff, then when an individual is laid off, their employer provides them with a return to work date. And so that's already in the system. And so when that return to work date hits, that person's benefits cut off. And so they're no longer, eligible to receive unemployment insurance. We did not do that this time because we honestly didn't know when we would be at this point. So what we have done is we are allowing employers to now submit their return to work dates for their employees. Employers are familiar with this site. It's where it's the employer self-service website for unemployment insurance. And that website is kewes.ky.gov. So employers can log on, they can submit the names of their employees that are returning to work and the date that they're returning to work. They can do that one by one, or they can download, or they can upload information as well. Also for employers that e-claim, so for the mass layoffs, they can submit return to work dates through that process as well. So this is critical because this will trigger a stop of benefits for an individual automatically in the system. Individuals, when they are requesting their payments, they are prompted to enter any wages that they've received or to notify if they've returned to work. So this is on them as well. It's just not on employers. But when employers can submit a return to work date for an employee, we're able to automatically upload that into the system. And that will put a stop to those payments from going out. And that way, they won't even be able to be requested. Now, there are a couple of exceptions right now because of the flexibility provided to UI in the CARES Act. That is dependent care in particular, so child care or taking care of another family member whose care facility is currently closed. If that happens, if that's the case for an individual, then when they go to request their benefits, even if they have a return to work date, they will be allowed to request an exception for dependent care. The other is if someone has to self-quarantine. So this really falls into the at-risk category. We've been working with the U.S. Department of Labor on this to get clarity on, how do we verify that someone is high risk? And the U.S. Department of Labor has said, yes, someone can request an exception to stay on UI and not return to work if they fall into one of those at-risk categories, but they have to have a statement from a doctor saying that they cannot return to work. So it is not a self-certification, but that is an exception. All of the other kind of CARES Act related exceptions have to do with an employer generated separation, whether that employer had to close, but or had to postpone operations. But the ones specifically around dependent care and being at risk or having to quarantine, those are the key exceptions that we're allowed to give at this moment.
So the employer would would submit the information, and then for everybody, and then the individual would be able to click in a couple of cases that exception box or whatever. Would imagine a button on there, and then with the doctor's note, I guess, submit that.
That's correct.
Exception.
That's correct.
So it's an employer-employee action item when it comes to dealing with those exceptions.
That's correct. So once the employer submits the return to work date, then the onus going forward is on the claimant, is on that individual. They have to verify that they've earned wages. They have to verify that they do not have a child care or dependent care option. And then they also would have to verify that they have to self-quarantine at the order of a doctor. And that can be because they've been exposed, or that could be because of their health risks.
Okay. Any thoughts on the vulnerable population in general, and when, I mean, is that essentially on the individual to say, well, I'm in this population and I've talked to my doctor and my doctor says, yes, I think you should continue to stay home. But any thoughts on when the vulnerable population, when those workers could actually return to work? Or will it really just be case by case?
I think it's going to be case by case. I think in both of these circumstances, with exceptions for childcare and kind of that vulnerable population, we would first like to see the employer and the employee try to work out a solution for, flexible hours, or, not being called back until, as Jonathan mentioned, some of those childcare options become available later next month. Work from home options, whatever those might be. We'd like to see those, those options be taken first, but the CARES Act does allow for that flexibility for those two specific situations.
And simply living with someone who is in a high risk group is not one of the exceptions, correct?
That's correct.
If you have a parent that lives with you, but you're not caring for them.
That's correct. It would have to be a care situation.
And if you find yourself in a situation where you have to self-quarantine because of you've been exposed, you've been told by contact tracers,
Mm-hmm.
there are different triggers. I mean, it might be unemployment, it might be sick leave. I mean, there could be different ways that you're compensated for that time off, correct?
That's
it may
correct.
not necessarily be that it would trigger an unemployment insurance claim.
That's correct. And we're also getting a lot of questions about, I don't feel safe at work. That the employer isn't providing the measures that are recommended, or the guidance that's been provided. I don't want to return to work because of that. As Jonathan mentioned earlier, that's something that the labor cabinet will work out by having to verify those safe work conditions. But if someone just doesn't return to work, that's, in the eyes of unemployment insurance law, that's fraud. And we run reports. Obviously, if there's a return to work date that's been provided by an employer, that stops the payment. But we have all kinds of measures in place that verify, are looking into fraud situations when someone shouldn't be claiming. There's also on our website where fraud can be reported if someone's been called back to work and they're just refusing to. First, I would tell that employer to submit the return to work date, but there's also measures to report fraud.
Okay, that's helpful. I'm getting several questions stuck on the child care issue
Sure.
specifically. So June 15th rolls around and there's some child care reopening, but maybe your facility has permanently shut down, or maybe it's opening at a reduced occupancy rate. Is there any way, would you self-certify that you still have that child care issue, or how would you document that from the perspective?
Yeah, the guidance from the Department of Labor is that it's the dependent care is a self-certification by that individual. Now, I think a lot of things are going to change, as things continue to open up. And let's say the best case scenario is, things continue to improve from a public health perspective. And there comes a point in time where we're not all operating under a state of emergency anymore. That's some of those flexibilities, both at the federal and state level, will be reduced, and it'll look more like normal. But until then, if someone does not have a child care option, they just have to self-certify that they do not, and they have to take care of a dependent.
Okay, it's helpful to understand. What about those that do not have a job to return to? I mean, maybe their employer has closed permanently. I know there were changes made where you don't have to look for work. We have a who's hiring campaign at the chamber, and just significant number of jobs that are open across the state. Is there anything connecting those individuals as we start to reopen that, you know, there are jobs available?
Yeah, those are conversations that we're starting to have. You know, obviously, our cabinet is a big cabinet, and unemployment insurance is just a piece of it. The majority of our workforce focus is actually on training and employment. And so we are, over the last couple of weeks, starting to restart some of those efforts, if you will. We had to have all hands on deck approach with unemployment insurance there for up to this point. But we have started transitioning individuals back into those training and job placement services. So that's going to be, a continued focus as things reopen. We have received a federal grant to help individuals that have been permanently displaced from their job to have resources for retraining. And we're working closely with the Workforce Center at the Chamber, KCTCS, and others to try to really get a handle on what job openings really exist that are permanent, that are sustainable, even in a time like this, and what training and education resources need to be applied in those circumstances. As it relates to UI, there will be a decision that we'll have to make probably in the next couple of weeks about taking away the waiver for job search requirement. So right now, we waived work search for unemployment insurance, but as things reopen and as hopefully more jobs become available, that we will look at pulling back that waiver for the work search requirement.
So that would be something done at the state level. That wasn't a federal action.
Yeah,
So
the federal government gave us flexibility to suspend it.
Right, and we appreciate the opportunity to work with you all on workforce issues, and I know our Workforce Center has been working just nonstop and identifying jobs that are available out there, and so we're of course eager to get folks back to work and to help with those connections at the chamber. One of the questions I'm also seeing quite a bit is, what if somebody comes back part-time?
Sure.
So I think maybe this is where WorkShare comes in. How does the federal UI benefit play into that? Is, maybe you're opening at a reduced capacity, so you need your staff back, but you don't need them back full time. What are your thoughts on that? Anything you can share?
Yeah, so with the CARES Act and some other federal legislation, they put an emphasis on WorkShare, also known as short-term compensation programs, for those purposes in particular. This was discussed on the original call that we had, and we had historically, we've had a very limited WorkShare program that essentially allows individuals to, if they have their hours and wages reduced, to continue to request UI and to receive partial benefit payments. That still exists. What we have been working with the U.S. Department of Labor on is a more robust short-term compensation program. We have filed a regulation for approval here in Kentucky, but are still waiting on, the federal contract and funding to be able to administer that more robust short-term compensation program. As it stands right now, because of the way that the old traditional program has worked, is that an individual can still, just because they have their wages and hours reduced, they could still not qualify for UI based upon what those weekly wages were. And so that's what we're still having to operate under right now. We don't like that because then you get in circumstances where An employer might have some employees that are receiving partial UI benefits and some that are not, just depending upon the positions and the wages of the employees at that employer. So we're working on getting that final approval for the short-term compensation program that just allows us more flexibility. It also provides funding specifically for that type of program. And we think that's a good long-term solution, especially, we don't know what the restart is really going to look like long-term. And so if we can have a quality short-term compensation program, that will allow more companies that flexibility to bring people on at reduced wages and hours and have their employees more fairly compensated from UI. So we're working on that, and as soon as we get all the approvals we need, we will roll it out. But right now, it's still operating under that old work-share program.
Okay, thanks. That's very helpful. Some of the other questions that we're getting, I know this is an area that we've worked on at the Chamber in the past, and unfortunately during the 2008 recession. Can you talk a little bit about the health of our UI fund, and where we go from here? All employers, really, nearly all employers pay unemployment insurance premiums, I think annually. And so as the fund drops, those premiums can tick up. So just any general thoughts on that and what it looks like right now? We've heard about maybe having to get a loan. Are we looking at getting a loan?
Right. So there's a couple of things that we've done. I think first, it's, when we talk about the amount of UI benefits that have been paid since really the beginning of March, I mean, it's well over $1 billion. The majority of that has not come from the trust fund. A good portion of it has, and don't get me wrong. But almost overnight, we went from administering the traditional UI program to 3 additional programs. Those programs were the pandemic unemployment assistance, which was for individuals who don't typically qualify, the additional $600 a week for anyone that's on unemployment insurance, as well as the 13-week extension for individuals that had already had their benefits expire since July 1. Those 3 new programs are all 100% federally funded. That is where, especially that $600 benefit, is where you're seeing the large numbers from, because our maximum UI benefit is not $600 a week. And so we're seeing really large numbers there. We started paying pandemic unemployment assistance. We were, I think, one of the first 3 states in the country to start paying PUA in early April, as well as the $600 and the 13-week extension. So most of that is federally funded. Our traditional UI program, of course, that's where the trust fund comes into play. We've been as cautious as possible with the UI trust fund, so that we can prolong a loan as long as we can. From the projections that we have, if things keep going the way that they are and we don't get additional federal resources, we're probably going to need a loan sometime towards the end of June, 1st of July. There's some things that are helping us stabilize that. One is early on, we waived the waiting week for unemployment insurance. And so under normal circumstances, someone goes on UI, they do not receive UI compensation for the first week that they're unemployed. The federal government waived that, and they also provided states reimbursement for the waiting week payments. So that has been extremely helpful, because obviously when we have paid out the number of claims that we have paid out, that first week of payments were very high. That's not a normal expense. So we're able to get that back. And just, being conservative, with the trust fund, and but it still looks like if things continue the way they're going, taxes, employer taxes have also been due this month, and so we've collected for those that were operational and able to pay, have been paying the UI trust fund tax, and so that's continued to put resources into the trust fund. But all things, if they continue like they are, we're looking at a summer request for a loan, unfortunately. What we don't know is what a next iteration of a stimulus package from the federal government might look like. We have been in conversations with our federal delegation about the need for trust fund solvency. We are not the only state dealing with this. I believe the last count, somewhere between 10 and 15 states that have already requested a loan. And so this is a national issue, just not a Kentucky issue. And even states that had really strong trust funds are experiencing significant hits to those funds right now. And so we're hopeful in a future round of stimulus funds that there'll be resources there for state trust funds.
Yeah, and it's important to talk about that because these businesses that have been forced to close, it was through no fault of their own, and
right.
So to have to turn around and pay higher premiums, higher taxes,
right.
to build back up that fund. I mean, it's troubling, especially at a time when we're trying to address our economic issues and grow our economy, kind of grow out of this. To have to then come with taxes, I think.
That's correct. And that's been our conversations with the federal delegation and they understand that. They understand that, when we start talking about recovery, that recovery is going to be hindered if that tax rate has to go up. It's going to slow hiring. It's going to slow investment. So they understand the concerns, and then they're going to do what they do on Capitol Hill, and hopefully they'll be able to provide some relief to states on that front.
Do you all have any thoughts or just following what might happen with stimulus in terms of the UI benefit from the federal level? There's the additional $600 a week benefit. I know, and during the recession, the Fed's extended UI benefit period. Any just general thoughts on that, or is it just something you all are following?
Yeah, we're just following it. Obviously, the current $600 a week is set to expire at the end of July. Obviously, it expires when somebody goes back to work. That individual is not able to receive that benefit anymore when they no longer receive UI benefits. Obviously, if it gets passed, we'll administer it. But right now we're just following it at this point. And waiting to see, what happens with the latest bill that came out of the House.
Mm-hmm. Do you have any advice for those? I have a few independent contractors that have been weighing in that are maybe still waiting on benefits. Will they be paid? Eventually they'll be paid, though paid late. Is there any sort of emergency hotline for those who've been at it for a while? I know you report on this regularly and you've really worked those numbers down. But
so right now we're down to, I think, 14,000 that are left in March and roughly 38 to 40 in April. And that's just not the independent contractors. That's across the board for both of the PUA and the regular UI programs. So, I would say over the past 8 weeks, it has been a continuous effort on continuous improvement in what we focus on and what we're processing. So what we've done over the last really week is put our best adjudicators on the remaining March claims, and then we will transition them to the remaining April claims. We're also looking at technology options that hopefully we may be able to start deploying next week that will help in claims review so that claimants can interact directly with the technology to clear up issues that they're having. It's in testing phase right now, but that's both with putting our best people. Right now, I've said this a couple of times, unemployment insurance was first created in the Great Recession, in the Great Depression, and it's been modified a few times over, but it was never intended to be a quick process, unfortunately. There are 27 different variables in a claim that can stop someone's payment at any given time. And so it creates challenges, especially with the volume that we're seeing right now. So most of the claims that are still being held up are more than likely, if they're going to get processed and approved, I'll put it that way, are more than likely because there was a mistake made on the initial application. And so, and there's multiple. I don't think we have many claims right now that haven't been processed that only have one issue left on that claim. So it's multiple things that we're having to clear up, and we're hopeful within the next week and a half we will have those more complicated March claims cleared up, and we're also working on the April ones, of course. But then we'll put our best folks on the more complicated April ones as well.
If you could remind everybody your website for the self-serve system.
Yes. Yep, it is kewes.ky.gov. And we will, we're going to put a link on our primary website that is just going to be a return to work link, so that it'll go directly to that self-service website. And then we're also putting together kind of a step-by-step guide on how to report return to work dates. We've just about got that finalized, and we will put that on our primary kcc.ky.gov website as well. So that'll be easily accessible.
And one last question, I've gotten it a couple of times. Somebody comes back to work, they go off unemployment, and then they find themselves unemployed again. Yeah. Does it start back over? And do you?
Well, they just have to reopen their claim.
Reopen the claim, and that would be the employee or the employer would be able to do it.
The employee reopens their claim. You know, on the mass claims, that's a normal part of that routine is, you know, working with our e-claim team so that they're submitting us lists of people who are off 1 week or back to work another week. So that's all part of the normal process. But for someone who filed an individual claim, they will just, if they go back to work and then they get laid off again, it's a matter of reopening that claim. They don't have to start from scratch.
Okay, very good. Well, this has been really helpful. I think we're winding down our hour here on these two topics. I really appreciate your time, Jonathan and Josh, for joining us. We did record this entire webinar as we do the Restart Kentucky series. So we will be posting this on the Restart Kentucky page. You can access it from our Kentucky Chamber page, kychamber.com. So if you had to step away or you missed something or you want to revisit some of the discussion, you can get that recording later today. As Ashley mentioned, we do have another session specifically on contact tracing later today, and it's with the governor and with Mark Carter as well. So we'll dive into a little bit more detail about how that will work, how the employer will be involved in that process, and what maybe more detail about what happens if you have an employee that becomes sick at work. So we'll continue to have those discussions. We're also working on a session on childcare as well as on with restaurants and retail reopening. And so we encourage everyone to continue to join us as part of the Restart Kentucky webinar series. And again, thank you to the Kentucky Community and Technical College System for sponsoring this. We really appreciate their partnership. They're a great friend of the Chamber, and we look forward to continuing to working with them. So with that, I will end this webinar. Thank you, Josh. Thank you, Jonathan. Hopefully see you all soon. Take care.
Thanks for having us.